Hey there, viewers! We all hear about skin cancer and its dreadful impact on the human body. It is by far one of the most common types of cancer in the US. Stats show that for cases with early detection, the 5-year survival rate for patients is 99%. The survival rates drop to 65% if cancer reaches your lymph nodes. The rate goes down to 25% with the disease spreading to distant organs. It's clear that if skin cancer is detected in the early stages, your chances of survival are very high. In today's video, we'll be discussing the early warning signs of skin cancer. What are the primary signs? Do different types of skin cancer have certain symptoms? What is the ABCDE method and the ugly duckling method? How is skin cancer diagnosed? We'll be talking about all this and more. Primary signs. There is a reason why you need to use good quality sunscreen. Skin cancer develops in the body parts that are exposed to the sun. This means your scalp, face, neck, hands, and legs are at higher risk of developing skin cancer. But that's not all. There have been cases where skin cancer develops in sun-protected places, like palms, under the finger, toenails, and private areas. This is common with melanoma, the most aggressive form of skin cancer. Researchers are still unable to find the exact reason for the development of skin cancer. The biggest risk factor of skin cancer is exposure to ultraviolet rays. These rays damage the DNA of the skin cells, which control how the cells grow, divide, and stay alive. Now comes the question of detecting skin cancer. The earlier it's detected, the better chances you have at recovery. As per experts, you should examine your skin from head to toe once a month. Check if you have any new moles or growths, any sudden growth in the mole or change in color, any lesions that bleed, dry up, and never heal, any formation, spot, or patch in pink, brown, or dark tones. Usually, these are the first signs of skin cancer. Are signs different for certain skin cancer types? The answer is yes. We discussed a few primary signs of skin cancer, but this is not a long list. There are different types of skin cancers like basal cell carcinoma, squamous cell carcinoma, and melanoma. Definitely had to check my pronunciation for those ones. The first two types of skin cancers are the most common. They're easily treatable and have a better recovery rate. But melanoma is a different story altogether. This is one of the deadliest forms. Let's talk about the warning signs for each. Basal cell carcinoma. You might be wondering about how to identify basal cell carcinoma. This type of cancer develops in the form of a mole, growths, and patches. They are seen mostly in the face, head, or neck. Check if the mole or growths have a reddish appearance. Is it itchy in some places? A flat, firm, or pale, yellowish skin area is also a sign of basal cell carcinoma. It'll often look like a scar or have tiny bumps in pink, pearly, or red translucent form. Sometimes the attached area will be blue, brown, or black. If you notice open sores that ooze out and keep returning, you need to consult a doctor immediately. A sore that never heals should never be taken lightly. Pink growths are another sign of skin cancer. Are you finding this video informative so far? Well, before we continue, why not subscribe to our channel for more videos like this and hit the bell icon so you're always up to date. Squamous cell carcinoma. Now let's discuss squamous cell carcinoma and how to recognize the signs. There is a very popular myth about skin cancer. The myth states that only people with light skin tones are at risk. People believe that if you have a darker skin, you won't develop skin cancer. Is there any truth in this popular belief? Actually, no. In fact, people with darker skin are at a higher risk of developing squamous cell carcinoma. It often develops on the body parts that don't see as much sun exposure. You can catch the early signs by routinely checking your skin. Make sure you don't have any firm red growths that bleed. A flat lesion with a scaly, crusted surface and a wart are both early signs of skin cancer. You never ignore open sores that refuse to heal. Sores that return after drying out are gigantic red flags. Before we move ahead, here's another video you might want to watch. Learn about the 10 body changes that need immediate attention. Melanoma. This is the deadliest form of skin cancer. There are pigment-producing cells in your body that add the characteristic color to your skin. The more pigment you have, the darker your skin tone. When these cells divide uncontrollably, they become cancerous and cause melanoma. The good thing about this type of skin cancer is that it's uncommon, but the bad news is it often spreads, making it very difficult to treat. This makes prevention and early detection the best bet against melanoma. The medical world has developed two ways to identify the visible signs of melanoma. The first one is the ABCDE method, and the other one is the ugly duckling. The ABCDE method. You already have moles and marks on your body, and they're pretty much harmless. It's different if you spot an atypical mole, one that's unusual and out of the ordinary. You can deal with this by applying the ABCDE rule. After spotting an atypical mole, look for 5 characteristics described through the letters A, B, C, D, and E. A stands for asymmetry. Most melanomas are asymmetrical. To put it simply, the two halves of the melanomas do not match each other. B for border. The common, harmless moles you have on your body are well-defined and have a well-developed border, but melanoma is a different story. They mostly have an uneven, rough border. C stands for color. Look out for multiple colors. Melanoma can have different shades of black or brown. When the mole grows larger, it'll have various colors like red, blue, and white. D is for diameter or dark. Most harmless moles are smaller than the ones caused by melanoma. Non-cancerous moles are just a small little mark, but melanoma is about the size of a pencil eraser or sometimes even bigger. E stands for evolving. A mole continuously changing its color, shape, or size is a big red flag. The melanoma mole changes might include blood, itching, or crusting. Ugly duckling method. This is another method used to detect melanoma signs and symptoms. This method uses the same premise as ABCDE. It considers all moles harmless unless proven otherwise. Moles that stand out from the rest in size or color can be an indicator of melanoma. This method is purely based on observation and your personal perception, which may differ from your healthcare provider. The main idea is not just to check for irregularities, but also compare the moles with each other to figure out which one is suspicious. Even an isolated mole without any for comparison may be the ugly duckling. But we cannot stress how important it is to remember that not all moles and growths are cancerous. Identifying potential skin cancer is not at all easy. It is good to be alert, but don't come to conclusions before visiting a doctor. Studies show that 20 to 30% of melanomas develop on existing moles, whereas 70 to 80% develop in seemingly normal skin. How the diagnosis for skin cancer takes place. If you notice any abnormal signs we described in the video, visit your healthcare provider. You'll be asked a detailed history of past medical ailments of you and your close family members. Next comes a close examination of the moles or abnormal growths on your skin. You might be suggested a full-body checkup to identify any other atypical mole or spots. Then your lymph nodes will be examined to check for any abnormal growth. It is helpful for you to give an account of the first appearance of moles and changes noticed thereafter. Next, a handheld magnifying device called a dermatoscope will be used to examine moles and marks. A small sample of your skin will be taken and sent for a biopsy to check for further signs of cancer. Did you know about these cancer signs before watching this video? Let us know in the comments below. We would love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.